the case study of a 67-year-old man is given to show that. Okay, so what are you looking for in this paragraph? You're looking for why this example is given, to show what. Okay, don't read the options, try to read the paragraph and try to come to conclusion where they are talking about a 67-year-old man. See, if you look at, see, it starts by saying this fact is highlighted in the case of a 67-year-old retired plumber. So obviously this fact means which fact? You have to read before that. Okay, one of the three types of asbestos related disease is asbestosis, a process of lung tissue scarring caused by asbestosis fiber. They are talking about that these are one of the three types of there are three types of diseases, and one of them is called as asbestosis. Okay, then the symptom of asbestosis usually include slowly progressing shortness of breath. That means the shortness of breath will progress slowly. Okay, and cough. So not just shortness of breath but also the cough. Okay, and often 20 to 40 years after exposure. That means it might take 20 to 40 years for this cough to, or for this disease to develop. Okay, breathlessness increase advances throughout the disease even without further asbestos inhalation. This fact is highlighted in the case of a 67-year-old retired plumber. Okay, so that means, so we know that there are 2 points that they are saying. One is that uh, the symptoms are slowly progressing shortness of breath. Okay, the second thing they are saying is that it is often 20 to 40 years after exposure, and it advances without further asbestos inhalation. Okay, so let's confirm if this is the factor that is told here. Okay, so he was on Ramipril to treat his hypertension. We are talking about this plumber. Okay, this plumber was in Ramipril to treat his hypertension and developed a persistent dry cough, which his doctor presumed to be an ACE inhibitor induced cough. So he doctor thought that it is because of this. Okay, the Ramipril was changed to losartan. Okay, so maybe if he thought that this Ramipril medications were changed. Okay, the patient had never smoked and did not have any history of asthma or COPD. The patient never smoked or did not have any history of asthma or chronic obstructive pulmonary disease. His cough worsened and he complained of breathlessness on exertion. That means while he was walking, he experienced breathlessness. Okay, in the view of the history and the fact that he was a non-smoker, he was referred to a chest X-ray and then to a local respiratory physician. So this guy was referred to a local respiratory physician. His doctor was surprised to learn that the patient had asbestosis. You understood? So his doctor was surprised to learn that the patient had asbestosis. Okay, then since he was suggested to the local respiratory physician, then his doctor was surprised to learn that the patient had asbestosis, diagnosed by a high resolution CT scan. The patient began legal proceeding to claim compensation as he had worked in a dockyard 25 years previously, during which time he was exposed. So he was exposed to asbestosis almost 25 years ago. Okay, but then he got it. Okay, so it took almost 20 to 40 years for this thing to develop. So that is the example that they are trying to tell through this, right. So if you read each option, smoking is unrelated to diagnosis of asbestosis. Doctor should be, smoking is unrelated to, so no, that is not what they are trying to show here. Okay, doctor should be able to diagnose asbestosis earlier, not doctor's problem also. The time from exposure to disease may cause delayed diagnosis. That means the time from asbestosis exposed to the disease is 20 to 40 years. That can cause delayed diagnosis. That can cause the diagnosis to be delayed. I think this option is right? Patients must provide full employment history details to, no, they're not indicating. So this is the right option to select. according, because this factor is highlighted in the example. That means it might take at least 20 to 40 years for a disease to for this disease to occur once he get exposed to this. Did you get this point?